Hi, my name is Karen Kaisa. The influence of hip strength and core endurance come recurrent patella dislocation. A pilot study. Definition: patellar instability occurs when the kneecap moves outside of this groove. Patella attaches to the femur and tibia by tendons. The patella fits into a groove at the end of the femur and slides up and down as the knee bends and strains. There are two types of patellar instability. The first is known as a traumatic patellar dislocation. This is most often the result of an injury to the canine. In a patellar dislocation, the patella gets pushed completely out of the groove. The other type of instability is known as chronic patellar instability. In this type, the kneecap usually only slides partly out of the groove. This is known as a dislocation. Application in Hi.
In this video, we are going to look at the patellar pubic percussion test, a screening tool for hip-related fractures.
Get our very own assessment ebook and mobile app. Links are in the video description.
Hi, and welcome back to Physio Tutors. Hip fractures will usually present clearly with pain in the upper leg, and the patient reports an adequate trauma during patient history taking, plus painfully limited range of motion. Plain radiographs easily reveal the site of the fracture, and the patient can be managed accordingly. Some fractures, though, are occult, meaning they don't appear easily on radiographs, which is what the patellar pubic percussion test assesses for. In their systematic review from the year 2013, Reimann et al. Report a pooled sensitivity of 95% and specificity of 86%. More recently, Smates et al. From 2018 assessed 191 patients with suspected occult hip or pelvic fractures and reported sensitivity of 85% and specificity of 70% with an inter-observer reliability of 0.7, which is why we give it a high clinical value in the diagnosis of hip-related fractures. To conduct the test, you will need a stethoscope. The patient lies in supine position, and you will place the bell of the stethoscope on the pelvis, lateral to the pubic symphysis, on the pubic tubercle of the site you want to examine. Then, tap on the patella and look for a distinct sharp sound, which would indicate a negative test. In case of a positive test, possibly indicative of a fracture, the sound would be dull. Compare your findings with the other side. Alternatively, you can use a 128 Hz tuning fork on the patella or on the femoral condyle. What you're examining here is whether the sound is conducted, also compared with the other side. Alright, if you want, continue by watching.
Application in physical therapy. If the kneecap doesn't go back in place, reduce on its own. Prompt medical attention is necessary to reduce the patella. The proposition the patella, the physiotherapist will perform isometric quadriceps exercise. The warranty is strengthening and that the posterior muscle of the leg can move normally. The physiotherapy that will be performed will always prudent and moderate painless application in physical therapy. Physiotherapy that will be performed will always prudent and moderate painless and without excessive resistance. The physiotherapist will decide the evolution that should follow in.
Patella or kneecap dislocations. So in the front of the knee, you've got the kneecap, which sits within the quads muscle, small tendon at the top, quads tendon, larger tendon at the bottom, patella tendon, and in there is the kneecap or the patella. Now in some situations, usually in sports or if someone's hypermobile, you can get dislocation. So the groove that the kneecap runs in is called the trochlea, and if you can see that, I'm not sure whether you can, it's got a groove which the kneecap sits within, so it articulates within that groove. Now in some situations people's grooves genetically will be thinner or less shallow, or more shallow, sorry, so it will be easier for the dislocation to occur. Or if people have got weak quadriceps or put into some vulnerable positions during sport, for example, the kneecap can be susceptible to coming out of that groove. Now it can be exquisitely painful. The quicker it's relocated, as in the knee straightened and allowed to pop back in, the better. You've seen perhaps some examples on TV where footballers have pushed it back in themselves, or rugby players. It can be very, very sore, and often people will go to A&E with this, have oxygen or gas and air, and have it pushed back in that way. Once it's been relocated, then you need to allow the situation to settle down. So often people are put into a brace for a period of time to let these structures heal, and then gradually building the strength up. Once they're able to take the brace off and improve strength work, it's critically important that strength is taken to a maximum level for that person, and the stability, the balance is addressed. Some interesting stuff on the website, but I'd again get a consultation with a physio who specialises in this area and get them to show you how to do exercise that's going to relate specifically to you, because depending on your age, activity, genetic predisposition, things may vary slightly, but overall improving the quad strength post-dislocation at the appropriate time is critically important to prevent recurrences.
Pros and cons. Pros. This pilot study was the first to investigate hip strain and car resistance as a risk factor for recurrent patellar dislocation, and more research is needed to confirm the findings. However, we can say that checklist diagnosing this type of injury that following the advice of a physical therapist in rehabilitation to the letter will allow the patella to return to its initial position, being able to resume our usual activity. Cons. Aspect of patellar dislocation explored in the literature include demography, radiographic findings, physical characteristics, and quadriceps and hamstring strain. There is a lack of information on muscle strain as a predisposing factor for recurrent patellar dislocation.
Patella is also called as kneecap. Patella lies in front of knee joint and protects the joint. In healthy individuals, upon flexion of the knee, patella glides up and down in a groove called as patella-femoral groove. Quadriceps tendon is attached to patella. Patella increases the leverage of quadriceps during knee joint movements such as straightening and extension. Patellar dislocation is observed when the patella slips or moves outside this groove into bony head of femur. Knee injury most often causes patellar subluxation and also known as partial dislocation. Patellar dislocation often results from severe blow or from twisting action of the knee joint. Patellar dislocation is initially treated with physical therapy and rehabilitation lasting 6 to 16 weeks. Patient is advised to consider surgery only if conservative treatment fails. Most of the time, after accidental dislocation, the patella will move back to its normal position with straightening of the knee. Procedure is extremely painful and may need sedation. Investigation. X-ray will show the lateral dislocation of the patella. X-ray is also used to evaluate the displacement of osteochondral fragment, which may be indicating emergency surgery. Treatment is necessary if there is an osteochondral fragment and displacement is present same time. Frequent patellar dislocation. Recurrent patellar dislocation is mostly on lateral side, and individual will slide patella manually into normal position while extending their leg. Risk factor of patellar dislocation: insufficient vastus medialis obliquus or VMO strength. The function of the VMO, which is vastus medialis obliquus muscle, is to maintain the patella in its normal position within the patellofemoral groove by pulling it towards the center of the knee joint at the time when the knee is moving. This is known as tracking. If the muscles or its fibers are not strong or sufficiently oriented, then the patella become more prone to dislocate. Q angle. Q angle is the angle between femur and thigh and tibia or lower leg. Genu valgus. Genu valgus is an anatomical abnormality of the knee joint caused by increased Q angle. Patients suffering with genu valgus may push kneecap towards outside, resulting in dislocation or subluxation. Subluxation is also known as partial dislocation. The subluxation or dislocation may occur while straightening their leg and when excessive force is applied to the inside of the knee. Patella alta is the condition of the patella where patella is smaller in size since the birth. The condition affects the mobility and leg strength. Treatment. Conservative treatment are complete rest, knee support like brace and A-strap bandage should be used during activities, anti-inflammatory medication, glucosamine, physical therapy to strengthen VMO, cryotherapy, apply ice over patella and knee, surgery, arthroscopy to assess the extent of the injury, surgery, repair and remove loose fragments, repair structural damage. Complication. 40 to 50% of conservatively treated patients will have recurring episodes of instability and patients will require surgery. Chondromalacia patella is a common complication after patellar dislocation. Chondromalacia is an inflammation of patella on inner surface and seen in sports injury.
ICU in Ecuador. In Ecuador, physiotherapists help for a speedy recovery, reduce pain, increase muscle strength, and will normally, as soon as possible, physiotherapists must ask the strength of the hip and central resistance for patients with patellar instability and incorporate intervention to address these deficits in your care plan. In Ecuador, there are several physical rehabilitation clinics. One of them is TMU Guayaquil, who, together with physiotherapy, will focus on patella in your recovery with modern equipment. Conclusion. Based on the research, we can determine that weak hip external rotators and core endurance could lead to an increased risk for patellar dislocation. The forward step-down test could be used to ask dynamic weakness in hip abductor and external rotators across providers based on reliability findings. Thank you.